Good morning, Tabernacle family, and welcome to another segment of our Health Nuggets. Today, I am Dr. Lenward McCalla, and today I have a special guest also with me. I'm going to have him introduce himself and tell us a little bit about his background.
Hi, my name is Jude Pear. I am a board-certified family nurse practitioner with my doctorates in nursing practice. I also have about 6 years' experience in neonatal ICU care as well as pediatric ICU care.
Now, you graduated recently, correct?
Yes.
When was that?
This December.
Okay, wonderful, wonderful. Glad to have you on board. I remember growing up as a kid, I didn't know a black doctor except back in Jamaica. When I came here to Miami, we didn't have one in the entire city. So it's good to have and see more of our people becoming doctors, whatever form you may be. Great to have you. Today we're going to talk about two things, the prostate and what you can do to help the prostate gland naturally, some natural things, before it becomes a problem. So let's discuss that. What is the prostate? How would you describe it if you were going to someone asking about it?
Well, the prostate is basically, it's about the size of a walnut, and it sits right under the bladder. It's a gland that helps secrete prostate. That's why it has its name. And its main function is in reproduction. So it's in the male body, the prostate.
So just males have it. Well, why is it important? I've heard that we have to check it once we get over 40 every year. Is that true? Is that how you were trained? Is that correct?
Yes, normally if you don't have any risk factors, normally if you would want to check it by probably age 50, but for African Americans, it's best to check it at the age of 40, because that's when you start to see some dysfunction in the prostate.
Okay. Now, there are two ways of checking it, correct?
Yes, there are.
Okay, all right. Can you give us a little bit of what is
Well, the
involved?
prostate, most of when it secretes the prostate, it's when you're like ejaculating or during reproduction. But some of that is also present in your bloodstream, and that's the PSA, which is the prostate-specific antigen.
Okay.
So you can do lab work when you go to your annual wellness visits and checkups, and there they can see the level that it is. And now normally that level, they would want it to be like under 4. When it gets to 4, between 4 and 10, you might think that there might be some dysfunction. Or if it gets above 10, definitely think there might be some.
Now, I know you had gotten some statistics. You had, so I'm looking down here, and it says between 4 and 10, you have a 25% chance of prostate cancer, and a 50% chance when it's greater than 10.
Yeah.
So it's very critical that this test is done. But I also know that they do a digital examination to determine if it's hard or it's enlarged. Is that something that you think is beneficial, or does the PSA take the place of that?
Definitely you'd want to have different modalities when you're trying to assess the problem in the body. So it'd be good to follow up with your PSA, because it's blood work, you can do that annually, but the digital exam is also very beneficial, because I know that for me, when I go to get colonics, normally I'm assessed, my prostate is assessed digitally when they're going to be assessing for the placement of the tube, and it's supposed to feel like the tip of your nose. It's nice
rubbery.
And soft.
Yeah,
rubbery.
okay.
But if it starts feeling hard, then there's an issue, and you may be like alerted, okay, let me check my prostate, let me keep track of my PSA to see if there's going to be an issue in the future.
Now, what can we do naturally to reduce our chance of prostate cancer or enlargement of the prostate? Are there things we can eat? I've heard that all these vegetables, like the green cruciferous vegetables, are beneficial. Is that true? The broccolis and the cauliflowers and those types of things? Is that something that you feel is beneficial also?
Definitely. Diet is a major part of any health and disease process. Like if you want to avoid any kinds of diseases, a lot of the nutrients that you get is going to be from the foods that you eat. and that's normally the best way for you to take them in, is to get them through the foods that you eat instead of like through supplements, even though supplements do help.
Okay, I've heard about lycopene. What is lycopene and how does it benefit the prostate?
Well, lycopene is a fat-soluble nutrient, and it's located in mostly it gives fruits their pinkish, reddish color. So when you think of watermelon, or when you think of papaya, guava, or tomatoes, which is really high in lycopene, those fruits are going to be the ones that have the most source of lycopene, and they also is a fat-soluble nutrient. So it's really good to consume it with oils, because with oils, it's going to absorb better into your body. So a lot of times, people want to eat like things with pasta sauce or things like that.
Okay, are there any other things like exercises you can do to help the prostate, or drinking any water or something like that that might help?
Definitely, a large percentage of the prostate is water. So what you would want to do is to consume an adequate amount of water. As well as you can do something called a Kegel exercise. It helps to strengthen the pelvic floor muscles. So for this exercise, it's basically, you can pretend that, because it's kind of hard to figure out how to actually strengthen this muscle. So if you were urinating and then someone just barged into the bathroom, that reflex that you would have to stop urinating, that is your Kegel muscle. So if you were to imitate that, or if you were trying to prevent yourself from going to the bathroom, like doing number 2, then that's also flexing your Kegel muscle. So if you do that and hold it for maybe 5 seconds and continually build on that, like maybe do it twice, hold for 5 seconds, and then release. And then gradually get to doing that for 10 seconds. That'd be a good way to strengthen your pelvic floor.
Great. Now, the next few minutes, we just have a few minutes left. I want to talk a little bit more about lycopene. I understand lycopene is a nutrient. It's a micronutrient that allows us or actually helps to prevent us from developing cancer, certain types of cancer, and one of them is prostate cancer. Now, where can we get the largest source of lycopene from?
The largest source, I would say, would be from tomatoes.
Tomatoes.
Tomatoes has the highest concentration, and also because you can have it with your salads, or you can have it in a sauce where you would also incorporate some kind of oil, which helps you absorb the lycopene. That'd be the most place to get it. The best place to
Now,
get it.
is it good to get it through supplements?
Supplements haven't been shown to be as beneficial as getting it from the actual fruit itself for this specific nutrient. So it seems to be more beneficial for you to intake it through actually eating your tomatoes, eating your watermelon, and other like red fruits.
Isn't there a study that showed that, I think I read that someplace, that a study that showed if you take lycopene from a supplement, it's actually, you're more likely to get cancer than if you eat it naturally in your food. So if you eat tomatoes, you can get it naturally. If you eat your guava, watermelon, things like that, even papaya or pink grapefruit. But the highest amount was the sun-dried tomatoes. But it's interesting that if you take the supplement source, you have a higher chance of getting cancer. But if you take the original, you actually will do much better. And I think it's a great, it reduces your cancer risk, I think, from about 33%, somewhere between 9 to 33% less risk by eating it naturally than trying to take it from a supplement. So this is one case where natural really, really, really makes a big difference over buying a supplement. A lot of us try to do things quickly, and we end up creating other problems. Well, we have a couple minutes more. Can we just run through some of the other benefits of lycopene for the body? Can you cover some of those for us?
Yes, lycopene has a lot of different benefits. It has benefits for your neurological disorders. It helps also for preventing strokes, helps with your immune system, and also helps with preventing degeneration from the sun and sunlight. So both for skin cancers. It also is beneficial for osteoporosis, for fighting diabetes as well. it's kind of like a very important nutrient. And since it's not in our bodies naturally, we really do have to make sure we consume it from the foods we eat and focus more so on organic fruits.
Well, two things that it does affect are two parts of the eye. Number one, we all are prone to getting cataracts as we get older. And if you take lycopene, it slows down that process. As we get older, just from being out in the sun and so forth, the ultraviolet radiation brings on cataracts. But it's a slower process by eating things, antioxidants, and lycopene is one of them. The other thing that it does, it's good for macular degeneration. Now, there are really two forms of macular degeneration. One of them is due to sun exposure. The other one is due to poor circulation. Especially the one with the sun exposure, it makes a big difference. Now, on black people, it doesn't have a greater effect as it does in Caucasian. And the reason why I say that, the pigment, the darker you are, the blacker your skin, the less likely you're going to get macular degeneration from the sun. It almost never exists in a black, dark person. It's always people with blonde hair, blue-eyed. But the portion that is from poor circulation, then that can be caused in any group of people. Yeah. Now, as we are really going to wrap it up, we're thankful that you've come in to sit with us and to get a little bit of more information about your health. We're going to have an AY program this afternoon. We're asking you to tune in and watch it. And also, see you next week when we do our health nuggets. And thank you, Tab family, for tuning in.
Thank you.